Welcome to Journey to Joy Live, a podcast to promote wellness, resilience, and inspire joy. Be empowered to balance your mental, physical, financial, aspirational, and social health while providing mental health awareness and breaking down the stigma of mental illness in the Black community. I'm your host, Dr. It Joy, and I'm here to help you transform life's challenges into opportunities for joy. Let's begin the journey together. Hello, welcome to episode 152, Shock Therapy, the truth about interventional psychiatry. Now it's shock therapy because we don't really call it shock therapy. I'm talking the ECT, electroconvulsive therapy, as well as TMS, the transmagnetic therapy, and ketamine. Ketamine is also a part of the interventional psychiatry. I haven't talked about this at all on the podcast, but I thought it would be fitting to discuss because let me show you this quick video. So this is where the American Psychiatric Association conference is, and there's protests. They're chanting, "Hey, hey, APA, how many kids, something. ECT, not for me. Stop the torture, ban ECT." I don't know what they're saying about kids. Maybe I should go another way to go to where I'm going to. But they seem not disruptive. So, as mentioned in the video, I was at the American Psychiatric Association in San Francisco last week, and there were all these protesters. I'm like, what y'all doing here? We're a bunch of psychiatrists doing great things. So in my head, I'm like, what are you guys protesting against? But of course, they're protesting against ECT. And I tend to attend the American Academy of Child and Adolescent Psychiatrists conference. I don't go to APA as much, but apparently every year these protesters come. And this was the first day of the conference. And so they were there and they weren't there any other day, but they were basically moved out of the way. But I'm like, okay, let's talk about ECT because there's a lot of myths out there and lack of knowledge behind the uses and the reason why we are using ECT and the reason why we're still using ECT and other interventional psychiatric treatments. And so people are like, ban ECT, ECT is terrible. I'm like, so what have you looked up? What do you not know about it? There's a reason that we still use it. And of course, I couldn't really understand the chant what they were saying about kids, but we ain't out here trying to kill kids. So I'm like, I have this platform for a reason to educate people about mental health and about our treatment. So that is what I'm going to do today. Let's talk about interventional psychiatry. There's movies like One Flew Over the Cuckoo's Nest, and people are looking at how people get locked up in asylums and crazy wards and things like that, and lobotomies, and that's not what we're actually all about. That's entertainment, but that's not what's happening. We're not doing lobotomies, and ECT is certainly not what people are thinking. And so that's why I'm gonna get into it, but let's talk about the myths real quick because what individuals think about ECT is that it's like this barbaric thing and that it's outdated and that we're just like giving people seizures to like shut them up or turn them into zombies. But no, it actually still is a modern treatment. Yeah, it's been going on for several decades, but it is a modern treatment, and it's a highly regulated medical procedure. So it's not like something that's like not regulated and not for it's for treatment resistant depression, basically. And it's performed under general anesthesia with muscle relaxants to help the person relax and to help them not feel anything. So you don't feel any pain. And it's definitely not like what you see in early historical versions, so it's very different from that, it's not what you see on TV. So today's ECT is evidence-based, carefully monitored, monitored, and widely endorsed by psychiatric associations worldwide. So, another myth that people have is that ECT is only used as a last resort when someone is crazy, like what you see on movies. Although it is for severe depression, treatment resistant depression, it can be used for catatonia when a person is due to whether it's because of multiple antipsychotics or because they're severely depressed, whatever the reason they become catatonic where they're not moving. Very slow movements, if anything. They're not talking, they're very rigid. And so there are treatments for that as far as medication, a benzodiazepine such as Ativan, but ECT can be used for catatonia as well. And it can be used for severe bipolar depression and sometimes for acute suicidality when someone is very severely suicidal and wanting to die and nothing else is helping. So, although it is a myth that it can be used as a last resort, that is in general what we do when other methods or treatments or medications have been exhausted. That is in general the case, but it's definitely not for people who are crazy. We don't even use the word crazy. And a lot of people, that's why there's stigma against going to see a psychiatrist. People feel like, I'm crazy. I'm not crazy. Wait, what? I don't need a psychiatrist. I'm not crazy. But it's about severity and urgency. If your depression is so severe and no other treatment is helping, this is why we start talking about interventional psychiatry, such as the ECT, TMS, or ketamine. And in some life threatening cases, it is the safest and fastest. There are places that they don't wait to the last resort. They don't wait until it's treatment resistant and they've exhausted all other treatments. This is the first. So they believe that if ECT or TMS is gonna actually work, then they believe, well, let's just start it first. I believe let's try a few medications, but it just all depends. Either way, it's not something that you must wait for. You can use it frontline. Some places do that, but I know if you come to see me, we're gonna talk therapy first, then medication, then use that for treatment resistant. Another myth people believe about ECT is that it changes your personality. Unfortunately, nothing really changes your personality. I know there's some people that you would wish to change their personality, but ECT does not change someone's core personality. But what often changes is the severe depressive symptoms, because that is what we're targeting: the hopelessness, the psychomotor slowing, the emotional numbness, which may make someone seem different simply because they're no longer deeply depressed. So if this person's been depressed most of their life or for a very long time, and you're used to a certain withdrawn, isolated, quiet person, then it's the depression that's treated if they're now happy and actually being able to live a normal life. So it's not that their personality changed, it's just now they're better. Another myth, ECT causes permanent brain damage, and this is probably what the protesters are protesting against, like, "Ah, you're gonna cause brain damage. What are you doing? Don't do ECT." No, there's definitely no scientific evidence that modern ECT causes structural brain damage. In fact, imaging studies suggest that it may promote what we call neuroplasticity. Neuroplasticity is neuronal growth and your ability to be able to make new connections in your brain, and in these new connections having mood in mood related regions so that you are able to feel better. So it targets the certain areas of your brain that helps you feel better. It helps release new neurotransmitters. Yeah, and new connections. The other myth, which I kind of understand this myth, is that you lose all memory. There are temporary memory changes that are common with ECT. The most common side effect is memory loss. And I've had a recent patient go through ECT last year. They went through, I think they did it for about 14 weeks. So it's not like this long-term thing. That's another myth, is that you need it forever. So it's not like this long-term thing, but it could be up from like 12 weeks, 14 weeks, maybe up to 18 weeks, but 3 times a week. And that's what she did. She did it for about 3 times a week. I think she did it for 14 weeks actually. And she did say that there were some temporary memory changes, but ultimately they didn't stick.
They often involve difficulty recalling events around the time of the treatment, but most memory effects improve after the treatment ends. Long term global memory loss is very rare. So, that common side effect of losing memory is no. As far as losing all your memory, no, that is not the case. Another myth, if medication didn't work, nothing will. Well, that's why we have ECT. Unfortunately, if medication doesn't work, we got something like ECT, and it often works when multiple medications have failed. Response rates for severe depression in ECT can be about 60 to 80%, which is significantly higher than many antidepressants in treatment resistant cases. Some antidepressants only treat up to 40%, 60%. So if we're talking 60 to 80% improvement for evidence-based treatment, why not? Another myth is that it's painful. So don't do it. It's painful. It's invasive. ECT is done under anesthesia. Patients are asleep and do not feel the electrical impulse or the electrical stimulus. They do not feel it. Some may experience a mild headache or some muscle soreness because, again, it is a therapeutic seizure that we are giving, but severe pain during the procedure does not occur. So, those are the common myths of ECT. Which, as I was explaining those myths, you kind of get a good understanding of what it is. But it is a therapeutic seizure that is given. ECT is one of the most effective treatments for that we even have for severe treatment-resistant depression. It's also used for severe bipolar depression, catatonia, as I mentioned earlier, and of course, life-threatening suicidality. So why would we not turn to a treatment that can work? As mentioned, it's performed under general anesthesia with muscle relaxation, and it is a brief, controlled electrical stimulus that induces a therapeutic seizure lasting about 30 to 60 seconds. And you don't feel pain during the procedure. The most common side effects, the short-term memory changes, of course, and especially around the time of treatment, but serious medical complications are rare, often properly screened. Rarely it's rare when properly screened. So, it's not necessarily that first line of treatment, it's usually after multiple medications have been tried and aren't working. But when you gotta get it, it works, and like I said, I've had patients where I've referred and they felt better, and they're just like, "Wow, I'm finally feeling better." It's not completely 100%, of course, it's like 60 to 80% improvement, as I said, but when you are so severely depressed and you actually get improvement 60 to 80%, maybe now we can move in some medications that could actually work, and maybe some people are without medication when it actually works. So, biochemically, ECT works to increase the brain-derived neurotropic factor because 'cause you're kinda like, "Well, what's happening? What are you doing to my brain?" So the BDNF, the brain-derived neurotropic factor, is increased, and that is a protein that supports this neuroplasticity that I mentioned earlier that helps the brain form the healthier connections. So it also can enhance key neurotransmitters. I talked about those before: serotonin, dopamine, norepinephrine. It can regulate glutamate and GABA balance. Those are the targeted neurotransmitters that we use when we are giving medications, where we're blocking certain receptors and increasing these neurotransmitters to help you feel better, less depressed, less suicidal, less aggression. So the ECT targets these neurotransmitters as well and helps to reset the stress system known as the HPA axis. And in simple terms, ECT promotes brain repair, basically neuroplasticity, promoting brain repair, restoring dysregulated mood circuits, and can rapidly reduce severe depression and suicidality when other treatments just haven't worked. So what we complaining about? I mean, like I said, it's not personal. It's not something that I would just send a patient to right away. It is something that people feel like, well, if it works, it works. Let's just go straight to it. But that is something that you want to talk to your trusted psychiatrist about and whether you would get it right away versus let's try a few medications. I mean, some people don't want to feel like a guinea pig of being on multiple medications, so maybe ECT could be for them. Interventional psychiatry isn't just ECT. I mentioned the transcranial magnetic stimulation. So you may have heard of TMS. So this one is more modern than ECT, less invasive. In fact, it is non-invasive treatment that uses these magnetic pulses to stimulate specific areas of the brain involved in mood regulation, particularly the left, pointing to my right, the left dorsal lateral prefrontal cortex. So it's definitely targeting the same areas as ECT and obviously trying to get to that mood regulation to reduce depression, but it's non-invasive and anesthesia is not even required for this one. You're not even put to sleep like ECT. So you are awake and can return to your normal activities immediately after the sessions. It's FDA approved for major depressive disorder, and there is growing evidence that it could actually work for anxiety and OCD. Response rates are a little bit lower, it's 50 to 60%, but if you're kinda scared to be put to sleep, anesthesia, the memory loss that ECT can have, or, afraid for, like, what is this, therapeutic seizure, then TMS is something quick that you can get. And there are remission rates, meaning you stay without any relapse into depression of around 30, 40% and treatment-resistant depression. So treatment-resistant depression means there's been 0% response rate. 100% remission rates. So if we're talking 30%, 40%, remission rates in treatment-resistant depression, which was 100%, and now you're down to 40, I think that's pretty good. Side effects are generally mild for TMS. You might get the scalp, discomfort or headache where they put the thing that they use. I'm blanking on that. Where they put the mold on to, your head, but the risk of seizure is extremely low. We're not, initiating a therapeutic seizure in TMS. TMS is often used, of course, just like with ECT when the antidepressants haven't worked, or when there's been so many antidepressants that have been tried and they all just have side effects. I have spoken to many patients who talk about, "Oh, medication just doesn't work for me. Those SSRIs, I don't like those. Those antidepressants, I don't like those. I get so many side effects. They make me gain weight. I lose sex drive. I'm too tired on them. I feel like a zombie. I'm suicidal. I go crazy on them. I'm aggressive on them." Those aren't all, like, common that would happen in a lot of people, but in those people where they have treatment-resistant depression, a part of that treatment resistance is that the medication causes way too many side effects. Not necessarily that they've been effective, but that they just cause way too many side effects and they can't take them. So, I suggest for people who medications just haven't worked, then trying something like ECT or TMS is a potential evidence-based treatment that can be helpful. Also, when you think of interventional psychiatry, ketamine, esketamine comes to mind. It isn't a therapeutic seizure like ECT, or it isn't a procedure that is done by placing modules on your brain to stimulate certain chemicals and balance in your brain, but it is actually a medication. So there's ketamine and there's esketamine, and it's kind of like this newer class of rapid acting antidepressant treatments. Antidepressants usually take about 4 to 6 weeks to kick in, and you have to take them every day no matter what. And so if there's something that's rapidly acting, then let's try it. And going back, most people say that they don't like antidepressants, um, and that Xanax is what works for them. What's the thing about Xanax? Well, I mean, it's a controlled substance, it's addictive, but also it's fast acting, it's rapid acting, so it, like, helps them right away. Doesn't treat depression, but it makes you feel good. So ketamine is good and growing like this increased, evidence and, like, hype about it because it's a rapid acting antidepressant, unlike something that's gonna take 4 to 6 weeks. So, it doesn't target serotonin like the typical SSRIs. It's called a SSRI because it's a serotonin no, a selective serotonin reuptake inhibitor, but ketamine actually works on what we call the glutamate system. If you really wanna know details, the NMDA receptors, and also can promote synaptic plasticity, so, like, enhancing those connections in the brain and helping you form, new neural connections so that you are able to be able to experience joy and have these neurotransmitters be more balanced and enhanced, like how the antidepressant should try to do. But ketamine does it more rapid. It takes weeks for an SSRI to do that, but ketamine and esketamine move faster. One of its most important features is the speed, and it can reduce depressive symptoms and suicidal ideation even within hours to days. So that is pretty dope if it's gonna be that thing that works for you. So ketamine is actually IV. You have to go into a facility to get it IV. Where S-ketamine comes in is that it's an FDA-approved nasal spray for treatment-resistant depression, and is administered still under medical supervision. You shouldn't be sending these to patients' homes, that's for sure, to just be spraying it. So IV ketamine is used, and monitored in clinical settings, but the nasal spray should at least be under medical, supervision. Obviously, the IV treatment, I mean, it doesn't have to be, like, in the hospital, you're not admitted, but, of course, in a clinical setting. Some side effects could be temporary dissociation. It is a psychedelic. That's where it first came from. So, there could be some temporary dissociation, maybe some blood pressure changes, but those aren't long term. Maybe some nausea, of course, that's not long term. But this is why the monitoring is required. This is why you shouldn't just be taking this home and like, "Okay, let me just spray it," like it's some Flonase. But it's not a magic fix. For some patients who have not responded to traditional medications, it can be transformative. It is something that you may use daily for a few weeks, but it's definitely not forever. Like for some people who are antidepressants, you have to take it every day up to a year of feeling better and then talk about getting off of it. But ketamine is for about a few weeks. It's not something that you're just going to be on forever, taking it every day. Yeah, no, not going to happen. So just wanted to come in to you guys this week and talk about this shock therapy. There's always so many myths about what we think is happening, but educating yourself, becoming more aware about what is really happening with these treatments and that psychiatrists are actually helping. But, protests like this is just gonna increase stigma about like what psychiatrists do and what the treatment is and what ECT actually is or TMS or ketamine. So I hope that you've actually learned something and that we are out here to reduce the stigma and increase our mental health and just knowing when you would go to something like ECT as opposed to like it being this thing of, like, one flew over the cuckoo's nest and the person's, like, vomiting at the mouth and, like, doing things without consent. ECT is in full consent. You're not locked up in the hospital when this is happening. Um, but but yeah, don't talk about my field. No, I'm kidding. No. Uh, Comment, like, subscribe, follow, share, ask questions, send to somebody who was protesting or that you know is a protester. Ask questions. Educate yourself. There's a reason for these treatments. Thank you for listening. This has been an Enjoy Life production. If you're in a crisis, don't hesitate. Call, text, or chat 988 for immediate support. Please note, this podcast is for informational purposes only and is not a substitute for professional treatment. If you're looking for therapy or medication management through Enjoy Life, visit www.drenjoylife.com to request a consultation. I'm licensed in 13 states. I accept Aetna in Georgia, Florida, and Virginia. Be sure to grab your copy of the Enjoy Note to help you on your wellness journey. Also check out Inspired Joy for the wife, mom, boss to help you balance it all without losing yourself. Better yet, get the full Joy bundle for just $45. Remember, Journey to Joy Live is every Thursday at 7 p.m. Thank you for joining me, and until next time, may you continue to transform stress into joy.